right, medications that'll low-key and high-key make you fat or make you gain weight. So first on my list is mirtazapine or Remeron. It's used for insomnia. And then in higher doses, an antidepressant for major depressive disorder. It's used as an appetite stimulant in animals. A better choice for patients might be trazodone. Next on my list is antipsychotics. Quetiapine and Zyprexa are the two that come to mind when I think what medications will cause a lot of weight gain that will not stop. So those two, Quetiapine and Zyprexa, come to mind. And the three in the drug class of antipsychotics that are the least likely to cause weight gain are ziprasidone and Latuda, which are similar in structure, and then Caplyta or lumateperone. Those three cause the least amount of weight gain or metabolic effects within the drug class. So this has to do with both its antihistamine activity and then also the serotonin 2C antagonism. So we have, of course, 7 different types of serotonin receptors. Specifically, 2C is where we get that side effect, antagonism or blockade of that receptor. So I don't know if any of you know what Belviq or lorcaserin is, but it was a weight loss medication. That was a serotonin 2C agonist, so acting on the receptor, and it was withdrawn in February of 2020. It was a voluntary withdrawal off the market due to potential to cause cancer. It was the only medication like it. Some more medications are hormonal medications like oral contraceptives or contraceptives in general, progesterone, medroxyprogesterone, magestrol, and then testosterone, namely muscle mass increase. Some downers can cause some weight gain, like gabapentin and Lyrica, benzodiazepines like your Xanax, diazepam, lorazepam, and then also Z drugs, like Ambien and Lunesta, especially if you have that complex sleep behaviors, which is the black box, like sleep eating. Yeah, that'll make you gain a lot of weight. Cannabinoids, like your classic weed. And then also dronabinol, which is a synthetic THC or Delta-9. It's on the market, branded as 2 different formulations. We have dronabinol as Syndrose, which is a liquid solution. It's a Schedule 2 controlled substance, so 1 step under illegal or illicit. And then we have Schedule 3 Marinol, which is a refrigerated capsule. So they're both used for chemo-induced nausea and vomiting. It's not the best choice for that. And then it also is used for anorexia in the medical term, like the medical sense, lack of appetite and wasting in patients who have AIDS. So it's used as an appetite stimulant. Another drug class are beta blockers, propranolol, metoprolol, stuff like that. Another drug class, antihistamines, namely first-generation antihistamines like Benadryl, diphenhydramine. And then another drug class, tricyclic antidepressants, like your amitriptyline. They have antihistamine activity. I will also mention some SSRIs. This is a very patient-specific thing, but Paxil seems to be the one of the drug class of SSRIs that causes the most weight gain. I'll mention lithium as well on my list. Steroids, like corticosteroids, like prednisone, dexamethasone, prednisone, stuff like that. And then I'll mention some bonus, not medications, but like disease states, I would say. So hypothyroidism, and then Cushing's disease, which is hypercortisolism. So that was my list, pretty comprehensive. Might make a video about medications that can cause like weight loss. So also, I did not go to Purdue. My parents did, my sister did, my brother did, but no, I went to Butler.